I'm Jocelyn Memento with orthopedic surgeon Dr. Julianne Forlizzi with Connecticut Orthopedic Institute at Hartford HealthCare St. Vincent's Medical Center. Patients have numerous options when it comes to hip pain that do not always involve surgery. Dr. Forlizzi, what are some of the more common hip conditions?
Sure. So we'll go by age group. In patients who are younger, so not skeletally mature or not done growing, we often have muscular tears or growth plate injuries around the hip. In the older population, there can be some wear and tear, or in athletes, we can talk about labral tears, and eventually some of these things do progress to arthritis.
Who's most at risk?
As far as athletes are concerned, it's usually dancers, ice hockey players, soccer players, or anyone who depends on their hip and proximal thighs, so their quads, for their sporting activity.
But your risk increases as you grow older.
Sometimes it depends on the type of injury there.
Okay. And typically, what age do people start to have issues with their hips?
The youngest I've seen is probably 11 or 12, but it definitely depends on the type of sport or activity they're going into.
When would surgery be necessary?
So in my practice and in most doctors' practices, we try to avoid surgery unless it's absolutely necessary. So our treatment usually begins with a physical exam, and then we talk about therapy to strengthen the elements outside the hip. Then we start to talk about injections, if those become necessary, and if those fail, then we start talking about surgery.
What are some of the current surgical options?
Sure, depending on the condition, we can talk about arthroscopic surgery for labral tears. That involves small portal incisions, about 1 centimeter, on the outside of your hip, where we use a camera and other instruments to perform the work inside the hip joint. And sometimes there's open surgery too.
Thank you, Dr. Forlizzi. For more information, log on to the website on your screen.